Now, besides the sympathetic nervous system kicking in, increasing our heart rate with beta 1, and we have vasoconstriction through alpha stimulation, these chemicals all being produced usually off of the adrenal gland, somewhere sitting above the kidney. We also have another system trying to compensate and combat hypotension or shock. The system is called the renin-angiotensin-aldosterone system. In the kidney, there are special receptors. As blood comes into the kidney and blood goes out, some of that fluid, if there's high pressure, is collected and then is turned into urine, which we see excreted from the body as urine. But as this blood flow comes into the kidney and releases back from the kidney, goes back into circulation, these receptors here in the kidney sense a low blood volume or hypotension or shock. As a result, it stimulates a thing called renin. This chemical, renin, is just a signal system that as it goes throughout the body, it then will meet and then form into angiotensin. This angiotensin is a potent vasoconstrictor. This occurs as this chemical here is secreted from this kidney, not the adrenal now, the kidney, goes throughout the bloodstream, enters into the lungs where it's converted into angiotensin. Angiotensin again is a potent vasoconstrictor. So a chemical that goes to the lungs is converted into angiotensin, vasoconstrictor. What we also know is that this system also acts on a system that secretes aldosterone. So here in the kidney, we have a release from this adrenal gland. It releases aldosterone, and aldosterone allows us then to reabsorb sodium, salt. When we look at this, again, the kidney again is being perfused by circulation that goes from the myocardium and through the renal arteries. When the renal arteries perfusing the kidney become very depleted, the kidney senses this low volume state. As a result, it secretes a chemical, renin. This chemical then is taken throughout the bloodstream and in the lungs is converted into something called angiotensin. Angiotensin is a potent vasoconstrictor, which allows the blood vessels then to constrict even more. It also has a stimulation of aldosterone, which comes off the adrenal gland, which helps us to maintain and collect salt, thereby keeping water and drawing water back in. We also mentioned previously that there is something else that also helps us to retain water. It's called antidiuretic hormone, or ADH. This is secreted from the pituitary gland. This helps us to retain water. As a result of these systems, including your sympathetic nervous system, that fight or flight system where you have adrenaline, epinephrine or norepinephrine, working to stimulate increased heart rate and vasoconstriction. We have other chemicals, proteins that are then placed into the bloodstream to cause vasoconstriction through the renin-angiotensin-aldosterone system, as well as retaining salt. The retention of salt helps to retain water inside the circulatory system. We also have another chemical that comes from the pituitary gland that helps us to retain water, so the kidneys no longer continue to produce urine, and the amount of urine that's being excreted from the kidney is less.